You said in French, Mr. Dubé, that you don't like to see the scenes of people lining up to get tested, and some people have to go back because they cannot get tested the same day, and it's a very hard situation. So what is your solution, and what do you see how the province will be able to do those testing, but in a more efficient way?
Well, we started over the last few weeks to make sure that when we saw this ramp up of testing, and especially since we move into 8 yellow zone, that people reacted, and we didn't want to say, no, you cannot get tested, even though maybe the necessity is not there, as Dr. Arruda said. So we've been working really hard with the CIS and CIUS, because they're the one responsible in those 8 regions to manage that. I think, as I explained before, but I'll repeat that because I appreciate your question, we try to work on the 3 aspects of the process. Managing the files, managing the lineups, to me, is the most obvious thing that we should do, and we're not good at that. We're not good at that. And I was in Montreal 2 months ago, and in the first open clinic, after an hour, we went around the block and said, just give those people a ticket, and they'll come back in 2 hours. They don't need to wait. But that's the minimum. I'm just talking about managing the lineup. The second part is with the labs. And the labs, right now, we have some issues because there are a lot of tests, but I think we should do better. We had some question about private labs. I think we should use more. I think we should use more. And I think that's something that maybe was not in our mindset, and I think we should do it. So that's part of the process. There are some issues. Now, the last part, and I gave this example earlier, but I think I talked to all the PDG of the CIUS at lunchtime, and I said, how can we have some people, for example, at the Jewish, that can connect with their patient by email and texto, and we cannot do that on the French side? Why? Is the law different in French than English to make sure that we can connect a medical report to our patient? No. So why don't we take those best practices? So I think there are simple things to be done on those 3 elements of the process to improve the patient service. Now, there are some issues that are difficult, very difficult, are the human resources aspect of it. Because when we have additional cases, as we do right now, we need the personnel to serve them. And unfortunately, we're limited in personnel because you need the professional nurses to do this. And unfortunately, we're short of them right now. So what I think the PDG are saying, well, I will need to cut a certain service to give those tests, right? This is what we call the délestage. I don't know how you say it in English, but you understand, you need to let go certain services to take those nurses and to do it. Now we challenge them again at lunchtime, and we say we're going to talk about it over the weekend. Are there other people that we should use over retired employees, people that can connect? We've been discussing that. I'll tell you, we're going to work on that all the next week to make sure, because I don't like this quality of service. I don't like it. I don't like it.